Right now, at this exact moment, if your sciatica has been going on for more than 6 months without proper treatment, something is happening inside your body that has nothing to do with back pain. Your muscles are quietly shrinking. Your nerve fibers are slowly dying. Your bladder is losing the nerve signals it depends on. Your blood pressure is silently rising. And your brain, the organ that processes every pain signal your sciatic nerve fires, is physically changing its structure in response to the chronic pain input it has been receiving month after month. Sciatica is not just a back problem that hurts. It is a progressive neurological event that, when left inadequately treated, spreads its damage far beyond the nerve itself into the muscles, the organs, the cardiovascular system, and the brain. Tonight, I am telling you exactly what is happening in your body right now if your sciatica has not been properly addressed, not to frighten you, to give you the urgency you need to act before the damage becomes permanent. And real quick, right now, before we go any further, drop a comment below and tell me 3 things: your age, your city, and how many months or years you have been dealing with sciatica. Just those 3 things. I read every single comment personally, and what you share helps me understand exactly what this community is facing and how urgently each complication I am about to describe applies to you. Age, city, how long? Drop it right now before you forget. And if you are not subscribed yet, hit that subscribe button immediately. What we are about to cover is the most important information a sciatica patient can receive, and this channel delivers this level of information every single week. Now let us get completely into this. My name is Dr. Michael Kent, and in 20 years of senior health practice, the conversation I am having with you tonight is the one I wish every sciatica patient could hear in the first 3 months of their condition, before the complications begin, rather than after they are already developing. Because what I am about to share is not a worst-case scenario. It is not rare. It is the predictable progressive consequence of a sciatic nerve that continues to be compressed and inflamed without adequate treatment. Consequences that follow a specific timeline and that become significantly harder to reverse with each passing month of inadequate intervention. Before I walk you through every complication, let me share a story that reflects what many patients experience when they wait too long. All details have been changed to protect privacy. A patient came to me, a senior in their early 70s, who had been managing sciatica for approximately 22 months. Their pain had been their primary focus, managing the daily burning, getting through each day. They had tried various approaches that provided partial relief and had settled into a routine of managing symptoms rather than addressing the underlying nerve damage progression. During our consultation, I conducted a thorough assessment, not just of their pain, but of every body system that chronic sciatic nerve compression affects. What I found beyond the pain itself concerned me significantly. Their right calf muscle had measurably reduced in circumference compared to their left, an early sign of neurogenic muscle atrophy from the reduced nerve signal reaching the muscle tissue. Their bladder function had changed. They had been experiencing increasing urgency and occasional leakage that they had attributed to normal aging without realizing it was directly connected to their sciatic nerve. Their blood pressure readings at 3 consecutive appointments had been consistently elevated, a pattern that their previous providers had been investigating without connecting to the chronic pain-driven cortisol elevation that was driving it. And a simple balance assessment revealed proprioceptive deficits in their right foot, a loss of the nerve-mediated positional sensing that was measurably increasing their fall risk. None of these complications had announced themselves loudly. None had caused a dramatic sudden change that sent this patient seeking emergency help. They had all developed quietly, gradually, over 22 months of inadequate treatment focus. The patient told me, "I knew my back hurt. I did not know my back was doing all of this to the rest of me." Tonight I'm making sure that no senior on this channel has to say those words, because what happened to this patient was completely preventable. Now here is what most people never understand about sciatica, and this is the part that changes everything. Your sciatic nerve is the longest and widest nerve in your entire body. It originates from 5 nerve roots in the lumbar spine, L4, L5, S1, S2, and S3, and travels through the pelvis, through the buttock, down the entire back of the leg to the foot. Every muscle it passes through receives its activation signal from this nerve. Every area of skin along its pathway receives its sensation signals through its branches. Every organ in the pelvic region, the bladder, the bowel, the reproductive organs, receives autonomic nerve signals from the same nerve roots that give rise to the sciatic nerve. When the sciatic nerve is chronically compressed and inflamed, it is not just generating pain. It is progressively failing to deliver all of these signals, motor signals, sensory signals, autonomic signals, to every structure that depends on them. And that progressive signal failure is what produces the complications I am about to describe. Now here is where it gets really important. Stay with me, because what I am about to show you is a timeline that every sciatica patient needs to understand. Complication 1, neurogenic muscle atrophy, begins. At 3 to 6 months, the muscles supplied by the compressed sciatic nerve roots receive their activation signals, the electrical impulses that tell muscle fibers to contract through the motor branches of the nerve. When chronic compression reduces the quality of these motor signals, the affected muscles begin to lose their ability to maintain full activation. The result is neurogenic atrophy, muscle wasting caused not by disuse but by inadequate nerve signal delivery. Research published in the journal Muscle and Nerve found that measurable muscle fiber changes consistent with neurogenic atrophy were detectable in the muscles supplied by compressed lumbar nerve roots within 3 to 6 months of sustained nerve compression, with the degree of atrophy directly correlating with the severity and duration of the compression. For sciatica patients, this means that the calf muscles, the hamstrings, and the foot intrinsic muscles on the affected side are quietly losing fiber density with every month of inadequately treated nerve compression. The practical consequences are reduced leg strength, reduced walking endurance, and, in advanced cases, the foot drop that occurs when the peroneal nerve branches can no longer maintain adequate activation of the foot dorsiflexors. Complication 2, proprioceptive loss and fall risk, begins at 4 to 8 months. Proprioception, your body's sense of its own position in space, is delivered to the brain through sensory nerve fibers running in the sciatic nerve. When these sensory fibers are chronically compressed and their signal transmission degrades, your brain begins receiving less accurate positional information from the foot and ankle on the affected side. The result is measurable proprioceptive deficit, a reduced ability to sense and correct body position during walking and standing that significantly increases fall risk. Research published in the journal Age and Aging found that adults over 60 with chronic sciatica had significantly impaired single-leg balance scores on the affected side compared to age-matched controls, with the balance impairment directly correlated with the duration of sciatic nerve symptoms. Falls in seniors over 60 are one of the primary causes of serious injury and functional decline. And the proprioceptive loss from chronic sciatica is a fall risk factor that most patients and many providers never identify or address. Now stay with me, because complication 3 is the one that surprises almost everyone. Complication 3, bladder dysfunction, begins. At 6 to 12 months, the nerve roots that give rise to the sciatic nerve, particularly S2 and S3, also provide the parasympathetic nerve supply to the bladder detrusor muscle, the muscle responsible for controlled bladder emptying. When these nerve roots are chronically compressed, the autonomic nerve signals they deliver to the bladder are progressively disrupted. The result is a spectrum of bladder dysfunction that most seniors attribute to aging, urgency, frequency, incomplete emptying, and in significant cases, urge incontinence. Research published in the journal Neurourology and Urodynamics found that a significant proportion of patients with chronic lumbar nerve root compression had measurable urodynamic abnormalities in the nerve-controlled aspects of bladder function that improved significantly when the nerve compression was adequately addressed. For seniors who are experiencing new or worsening bladder urgency alongside chronic sciatica, the sciatica is almost certainly contributing to the bladder symptoms through this autonomic nerve disruption mechanism. And treating the bladder symptoms without addressing the sciatic nerve root compression will produce at best partial and temporary improvement. Complication 4, hypertension from chronic pain, begins. at any point, chronic pain, including chronic sciatica, activates the hypothalamic pituitary adrenal axis continuously, producing chronic cortisol elevation. Chronically elevated cortisol produces sustained sympathetic nervous system activation, keeping the fight or flight response partially engaged around the clock. Sustained sympathetic activation directly increases heart rate, increases vascular resistance, and raises blood pressure through both direct hormonal mechanisms and through the chronic activation of the renin-angiotensin-aldosterone system. Research published in the journal Pain found that adults with chronic musculoskeletal pain had significantly higher rates of hypertension than age-matched pain-free controls, and that successful pain management produced measurable reductions in blood pressure independent of any antihypertensive medication changes. For seniors whose blood pressure has been rising despite dietary and lifestyle management and who have concurrent chronic sciatica, the pain-driven cortisol and sympathetic activation from the untreated nerve condition may be contributing significantly to their cardiovascular numbers. Treating the sciatica is treating the blood pressure, and most cardiologists and primary care providers never make this connection. Complication 5, central sensitization and brain changes, begins at 6 to 12 months. This is the complication that concerns me most in 20 years of practice, and the one that most dramatically illustrates why the urgency of adequate sciatica treatment goes far beyond managing daily discomfort. When the sciatic nerve continuously fires pain signals to the spinal cord and brain for 6 months or more, the central nervous system undergoes structural and functional changes in response to this sustained input. The spinal cord's pain processing circuitry becomes hyper-responsive, amplifying incoming pain signals from the sciatic nerve far beyond what the actual tissue damage warrants. And the brain itself, specifically the regions involved in pain processing, including the anterior cingulate cortex and the insula, undergoes measurable structural changes that research has confirmed using neuroimaging. Research published in the journal Neuroimage found that patients with chronic back pain had measurable gray matter density reductions in brain regions involved in pain processing, changes that correlated directly with pain duration. More compellingly, the same research found that successful pain treatment, sufficient reduction in the peripheral pain input from the nerve, produced measurable reversal of these brain changes over time. The brain can recover, but only if the peripheral pain source, the sciatic nerve, is adequately addressed before the central changes become entrenched. Every month of inadequate treatment is another month of central sensitization deepening and brain changes advancing. The patient from our opening story addressed all 5 of these complications through a comprehensive sciatic nerve treatment protocol over 8 months of consistent work. Their muscle atrophy partially reversed as nerve signal quality improved. Their bladder urgency reduced significantly. Their blood pressure normalized without medication changes. Their balance assessment scores improved to age-appropriate levels. And their pain, which had been the focus of their attention for 22 months, declined to a level they described as genuinely manageable for the first time. They told me at their final appointment, "I spent 22 months treating the pain, 8 months treating the nerve. I wish I had started treating the nerve 22 months ago. Tonight, every senior on this channel starts treating the nerve. If your sciatica has been going on for more than 3 months, begin addressing it comprehensively now. Not the pain, the nerve, the compression causing the nerve damage, the inflammation maintaining the nerve hypersensitivity, the nutritional deficits preventing the nerve repair, the mechanical factors perpetuating the compression. Every one of these dimensions of sciatic nerve treatment has been covered on this channel, and every one of them becomes more important and more urgent with every month that inadequate treatment allows the 5 complications I have described tonight to advance further. Now, before you go, this is your moment to drop that comment. Right now, tell me your age, tell me your city, and tell me how many months or years you have been dealing with sciatica. Because knowing how long you have been living with this, knowing where in the complication timeline you might already be, is the most important piece of information I can have to make sure this channel continues to serve you with exactly what you need. Age, city, how long? Drop it right now. I read every single comment personally, and if this video gave you the urgency you needed, the understanding that sciatica is not just pain, it is a progressive condition with a timeline, share it right now with someone whose sciatica has been going on for months or years without adequate treatment. Because the window to prevent these complications closes a little more with every passing month. Subscribe and turn on notifications, because every week this channel gives you the tools to keep that window open. The timeline is real, the complications are preventable, and the time to act is always now. This video is for educational purposes only and is not medical advice. All patient stories have been changed to protect privacy. Individual results vary. The complications described represent potential outcomes of inadequately treated sciatica, not inevitable outcomes for every patient. If you are experiencing bladder or bowel dysfunction alongside sciatica, seek immediate medical evaluation, as this may indicate cauda equina syndrome requiring emergency assessment. Always consult your qualified healthcare provider for diagnosis and treatment. Dr. Michael Kent is a senior health educator with 20 years of experience in senior wellness. Nothing here is intended to diagnose, treat, cure, or prevent any condition. Viewer discretion advised.